Thank you for joining us today. My name is Nakielny and I help as part of the technical team for the Farming Connect side of things. Also today to talk about liver fluke in sheep, we've got Sian Mitchell, and Sian, you're going to introduce yourself.
Yes, I'm Sian Mitchell, I'm a veterinary surgeon and I work for the Animal Plant Health Agency, but I'm based at the laboratory in Carmarthen.
So I thought today we're just going to have a chat through, myself and Sian, some of the common issues, common questions that might arise from how to deal with liver fluke in sheep, and we'll just run through the presentation and we'll have a bit of a chat through, so hopefully this is going to be of use to you. Right, so the first question I have really is kind of what is liver fluke? Obviously it's a parasite, but can you maybe say a little bit more about it and you know, how it's quite well adapted to sheep?
Yes, liver fluke is a very successful parasite, particularly in the western half of the UK, the wetter west. It's also a parasite that's very dependent on weather, and the weather affects its life cycle and its capability to infect sheep, very much so. It is a large parasite, one that you can see with the naked eye when it's an adult, and it basically causes damage to the liver, either acutely by causing blood loss and death just simply by the young ones going through the liver, or when it matures to become adults, it sits there causing liver damage, which obviously affects production and can cause death at that stage as well.
And does it live throughout the liver or specific areas, you know, in the liver?
Well, a sheep will take in the infective stage into the gut, and it'll actually burrow from the gut to the surface of the liver, and then it'll migrate through the sort of surface lining of the liver, right the way through the liver substance, if you like. But then it'll go into the bile ducts and eventually into the gallbladder when it's adult. During that time, of course, it will also, when it's adult, lay eggs, which come out then into the intestines and out in the feces.
So could you explain a little bit more about the liver fluke cycle? Because my understanding is it's a fairly complex life cycle, so maybe if you could run through a little bit more about how the sheep gets infected and how that life cycle carries on the ground.
Yes, you're right. It is a complicated life cycle in that there is an intermediate host, the mud snail, that is responsible really for it being quite a successful parasite. So when we talked about the adult fluke being present in the liver of the sheep, and that they lay eggs and that comes out in the feces, so that contaminates the pasture. They then hatch, and they have to find the mud snail very quickly, and they need ideal weather conditions to do that as well, particularly films of water to do that. So they have to find the mud snail very quickly to survive. But once they get into that mud snail, there is a big multiplication phase that carries on through a number of stages. So the mud snail, for one egg going in, if you like, produces hundreds of infective stages coming out the other end. So that really adds to its successfulness as a parasite. When these infective stages are shed from the mud snail, again you need mud, you need moisture for the mud snail to survive, but again you need moisture for these infective stages to swim up the grass and to insist. So they lose their tails, so again they need films of moisture to do that, and then they insist as the infective stage, which is called the metacercaria, sitting there ready for a sheep to come along and take it in. And don't forget that unlike gutworms, sheep do not gain any significant immunity against liver fluke, and the same really with cattle. So adult sheep are as susceptible as younger sheep.
And we're recording this at the end of August 2018, so obviously we've had a fairly dry summer. Does that take away the risk of fluke this year, or how quickly does weather influence the amount of sort of mud snails present on a farm? Should we be less worried this year, or?
I think undoubtedly the levels of infection we will see this coming autumn and winter will generally be lower than we saw last year, because it's usually the rainfall, particularly between May and October, Now we're at the end of August, we've had a very dry time, but now we're getting a bit of rain coming through. So the dryness will have affected the mud snails. They won't survive so well, they will have less feed. So that will affect the intermediate host. It will also have affected the ability of the mud snails to be infected. So undoubtedly there will be lower levels, but beware beside wet areas that may still remain beside rivers, beside water troughs, particularly where sheep will go in dry weather looking for forage, looking for feed, could well have infection. So I doubt it's gone away, but it should be reduced generally in levels from last year.
Okay. And will repeated dry summers have an impact in the long term, or obviously we're probably, this summer's been fairly unique, so we're likely to see it every year. But if we have a period of dry summers or cold winters, will that have an impact, or vice versa? Yeah.
Yes, the dry summers are the key to reducing down liver fluke. That could significantly reduce down the risk to disease generally, particularly if we have a series of them, as you say. They are quite good as a parasite in surviving, and in its infective stages, in surviving colder winters. So it's not so much the cold winters, it's the hot, dry summers that are the key to defeating this. So we need to make sure we have a series of hot, dry summers, and it'll be less of a problem.
Yeah, I think mentioning the fact that the cold winters don't have that much of an effect is quite useful, because I know some people said in the past, when we've had those very cold winters, that it's going to be good for the liver fluke parasites, but actually it sounds like they can survive quite well. So
yeah, the mud snail can hibernate, and the Metacercariae, the infective stage, can survive quite low temperatures, can survive on pasture, almost up to a year. Undoubtedly, very, very cold winters, -20, that sort of level will have an effect. But our general mild winters, no, they will survive that.
So you mentioned the importance of mud snails in the life cycle. Obviously, they're not the kind of normal snails you see sort of in the garden or anything like that. Are they quite different to that type of snail, and what kind of habitat do they actually like to live in, and what kind of land should we be thinking about when it comes to potential infection with mud snails?
Well, yes, they're not the ones that you see in your garden generally. Their technical name is Galba truncatula. They are a mud snail. They're generally a bit smaller than, I don't know what the big ones are you see in the garden, but they're smaller than that. They like, as the name suggests, mud, muddy puddles, things where not fast moving water, but sort of stagnant or moist areas. They don't like very acidic environments. So peat bogs apparently don't support them very well, but generally our countryside, particularly here in Wales, does support them very well. So round water troughs, tracks of tractors, things like that. Not necessarily just the rushy fields. It's areas of mud where they actually graze on algae, so they need mud with algae on the top to survive. That's where they're generally found.
Yeah, so I think there's a tendency to think about mud snails inhabiting sort of those rushy fields, but it sounds like actually, as the name suggests, they do actually need mud, bare mud, and not just a rushy field. So in terms of, obviously, for a lot of areas then, that habitat is fairly specific. So it's possible through maybe drainage or fencing, or
yes.
I suppose even things like some of the glacier small grants where they've looked at putting in hard stone in gateways. So could they all help?
They could all help.
The habitat for them.
Yes, they could all help, certainly. So you're right with the gateways, certainly. And also we talked about water troughs, making sure that they're not leaking, and areas hard standing around theirs can all help. And yes, you can certainly avoid your wettest habitats at the greatest period of risk of disease as well. So yes, all those things can help to reduce down the habitat.
And it is possible to see the snails. They're quite small, aren't they? But it is potentially possible that if you were to learn more about it, you could actually then go out on your own farm and have a look. And
yes, you could.
Yeah.
Yes, they are visible with the naked eye. Yes.
So we talked a bit about sort of where the mud snails live, and obviously you mentioned about the temperature and about the moisture requirements for them. So does that have an impact in terms of when you see the biggest population of mud snails on a farm, and how does that then impact on sort of the liver fluke problem in sheep or cattle?
Yes, you are limited in what you can do really to help control liver fluke, but one of the main things you can do, you can think about the rise in population in mud snails on your farm and trying to prevent them becoming infected with liver fluke. And the way you do that is you consider whether your animals are actually putting out fluke eggs onto the pasture round about the sort of springtime, late springtime, because if they are, that's the ideal time for those infective stages to go into the mud snails. Population's increasing, and then infection goes into those mud snails. That will then lead to a peak of infective stages for your sheep in the late summer, autumn time. So if you can prevent the infection going into the snails, you're going to have you're going to reduce down that peak of infective stages on your pasture in the autumn time.
Yeah, because obviously you tend to think of liver fluke being a winter problem really, but it sounds like that actually we see the signs of that in the winter and the autumn and the winter, but actually it's the summertime or the late summer where sort of the infection is building up.
Yes.
So it's sort of, we need to be thinking maybe 6 months ahead of when we see potential problems in animals.
Yes, try to get ahead of this disease by thinking about reducing down the infection in the intermediate host. Undoubtedly, as a disease, it is primarily a disease of the autumn and winter and even into a bit of late spring on bad years, but you want to try and get ahead of it and start thinking about it, you know, in springtime, late springtime, to prevent the coming autumn increase in infection.
And I think we're going to have a chat through some of the treatment options, but are there, so obviously the timings of treatments could link in quite well with how the mud snails and how the liver fluke parasite then develops within the mud snails. So we can have a chat about that later on through the presentation on specific treatment options. So you mentioned in the sort of first slide that obviously liver fluke can cause a death and reduce performance in individual animals and across the flock basis. But can you say a little bit more about what you see and about sort of the different levels of disease you tend to see at different times of year and some of your experiences of having animals and samples come into the lab here in Carmarthen?
Yeah. So probably the most dramatic is when we have, usually following very warm, wet summers, and that leads to a peak of infection in the late summer and autumn time. So sheep are being exposed to large numbers of these infective stages, the metacercaria, on the pasture, and if they take them in over a very short period of time, you get all those hatching within the gut and moving across to the liver en masse, if you like, and that can cause death very quickly, simply because of the total disruption to the liver. So you will get good condition animals being found dead round about the autumn time. And when you open them up, you tend to see a large blood clot just sitting on top of the liver, and the sheep itself is very white because it's lost a lot of blood there. So it's not the chronic effects that you see later on of the liver fluke feeding, it is purely the damage en masse to this very vascular organ, the liver.
So it's a physical damage to the
blood loss,
yeah,
and acute death. Yes. That can move on if they haven't taken in so many over a short period of time, if they've taken on smaller numbers. These smaller fluke obviously develop within the liver, causing damage as they trundle through the liver. For about 6 to 8 weeks they trundle through the liver. That can also cause another disease as they move through the liver called black disease, which is a clostridial disease. We do see it associated with the damage caused by liver fluke in sheep, but more commonly perhaps we see it in cattle as well, because cattle often aren't vaccinated against black disease, whereas sheep often have multivalent vaccines, clostridial vaccines, and they're covered. So anyway, as the liver fluke are trundling through the liver and getting to the bile ducts and the gallbladder, they obviously cause damage. The liver tries to heal itself, so it starts to fibrose a bit, which obviously means it can't function very well. So at this stage, you tend to have an animal that just can't take in the nutrition that it should do, and that'll depend on the extent of the liver affected. When they ultimately, you can have an animal that again is pale, because these liver fluke have caused some blood loss, but also they feed on blood, so the animal's anemic. They also are low in protein. These animals are low in protein, just generally in their blood, so they're hyperproteinemic, so that can lead to fluid below their jaw, is where you usually see it in sheep. And they're not doing so well. They are poorly, they've lost weight. When you open them up, you have a liver that is often shrunken, it may be paler than normal, it's a bit misshapen. You cut into it, you can see the adult fluke oozing out from the cut surface of the liver, and there may be a lot of fluid free in the abdomen, maybe free in the chest, and you can see free fluid under the skin below the jaw as well.
So if as on a flock basis, you're getting animals with sort of more of the chronic fluke, where it's not killing individuals but it's affecting their liver, do you see effects on things like scanning percentage? Because obviously it's a time of year when ewes are being mated. Is that something that people should be looking at for?
Yes, I mean, it certainly would be one of the differentials. And a couple of years ago, when we had reasonably high levels of liver fluke, it certainly seemed to be involved in poor scanning results in farms that hadn't experienced liver fluke for quite a while. So yes, that timing can be a big, and it can be a prelude to, it can be underlying lots of other diseases, because it's known that liver fluke itself can be immunosuppressive, and really even just generally, if an animal is fighting that with its liver, it's not going to have the capacity to fight other things that it would do normally.
So you'd be looking at potentially things like reduced condition score,
yes.
Obviously reduced poor scanning results,
yes,
other losses and other sort of problems, diseases, and
yes,
yeah. And on the with lambs, obviously, when are they sort of picking that up? So you've talked a bit about obviously the effect it has on ewes. In terms of lambs that are present on farm in the autumn, presumably they're going to be equally susceptible to picking up liver fluke. And what kind of effects might you see in growing lambs at that time of year?
Yes, well, certainly they are as susceptible. So it would be more in the late summer, autumn time. They could be starting to pick up infective stages. They could have the whole gamut of signs, really, that we see in adults. If they get in enough, you could have disease, death due to acute fluke. But equally, picking up smaller numbers, perhaps they wouldn't be growing quite so well. They wouldn't be going on quite so well. And then, of course, if they're sold to the abattoir, you potentially will get your return saying that there was liver fluke found in the carcass.
And I suppose there's a value there of recording, or trying to look at how lambs are growing, recording that from year to year and group to group, in case you can pick things up before
yes.
they get to a point where they're significantly going backwards, really. So
yes, and also be mindful of your abattoir returns. That can be a useful monitor. Disease may not have been at any significant level, but if they've detected it in the livers of your lambs, that's quite a good monitoring for your farm generally.
And I suppose in the autumn time, you've got potentially higher worm burdens depending on how well your wormer programs work. So you could have liver fluke and
yes, very much so in the
lambs. Yes. So
yes.
So it's worth trying to work out what's going on with them if they are not growing or coming on as much as they should.
Yes.
So when it comes to parasite control in sheep and cattle, there's obviously a lot talked about now about the value of fecal egg counting, looking for the worm eggs. Is that, and this is a picture here of a liver fluke egg, is that of value to do egg counting for liver fluke? What's your views on that?
It can certainly have a place. What you must remember that you're doing with looking for liver fluke eggs is you're looking back in time, probably 3 months before when that liver fluke was taken in by the animal, so much longer time before they start to egg laying, which is about 10 to 12 weeks following infection. It shows you that infection's there, and certainly when we talked about looking for infection 6 months ahead to stop the infection going into the mud snail, then a combined fluke egg count from your ewes at that time could be quite useful to see, because it's those eggs that are hatching and going into the mud snail. But there are certainly other diagnoses available. So there's the copper antigen test, which again is done on faeces, but that can detect infection a bit sooner than seeing eggs. So you're detecting products of the fluke sooner than you're seeing the eggs in the faeces. That can be also useful in sort of monitoring infection. It can also be used when you're wanting to try and check efficacy of a flukicide that you've given, because you can look that little bit sooner. There is also serology tests, so that's looking for antibody to fluke on blood samples. That can be very useful, particularly in lambs. And you can use it as a sort of on-farm monitoring tool if you can, if you're able to blood sample lambs in the autumn time, small number of lambs in the autumn time, to check when they turn positive, because then you're having surveillance for your farm with your sheep. So it's very, very accurate, really, as to when they become positive, so you know that liver fluke is becoming active on your farm. You can also use the serology test on bulk milks, and that's used obviously in dairy herds.
So with the serology test for lambs, you'd maybe start testing sort of maybe August, September time, depending on the year.
Yes.
And then once your lambs go positive, that would be the signal maybe to treat the ewes, or
yes,
at least have a chat to you about.
Yes, you certainly then to think. You need to assess where those lambs have been in relation to the rest of the flock. You need to put that into context with where those lambs are going, but also your adult flock, as to whether that's the time to start a treatment for the immature fluke at that stage, because timing for immature fluke is very variable from one year to the next. The risk period can be as early as August if we've had a very, very wet summer, or it can be into December, time. So yeah, it's timing for that treatment for acute fluke. That's when it can be useful.
And the serology test is you'd only do it in lambs? Is that...
Well, no, you can use it in adults, but it only indicates exposure, and it is present. It will be positive for a number of months. So a lot of sheep in the autumn winter time will be positive anyway in this area. If you lived in the east of the country, where liver fluke isn't, the east of GB, where liver fluke isn't as common, then it can be used more as a tool for surveillance. But because liver fluke is so common over here, its main use is using in lambs to indicate when exposure has taken place.
So once they start coming positive for antibodies, they picked it up on that farm.
Yes, exactly.
Yeah. So obviously we've talked a lot about the impact that liver fluke has on sheep in terms of reduced production, or even the death of individual animals. And there are treatment options available in terms of sort of parasite treatments, but there's different types, and I was just wondering maybe you could run through how they vary, and also then maybe the times of the year you might be looking to use the different types of product.
Yes, all the flukicides available for sheep and also for cattle are all quite old drugs, really. They've been around for a long time. The most recent is triclobendazole, which is the most broad spectrum as regards the age of liver fluke it can kill. So it is active against the very young stages, down to about 1 week in sheep, and it will kill adults as well. So that's the most broad spectrum one. So that would be your treatment of choice in the autumn time, because it has good efficacy against the very young stages of liver fluke. The next best, if you like, in broad spectrum range are nitroxanil and closantel. These two drugs are quite similar in that they treat the sort of immatures and the adult liver fluke. So they're the next best thing after triclabendazole. They vary in how they're given. Closantel is oral, nitroxanil is an injection. Triclabendazole obviously is oral in sheep as well. But closantel and nitroxanil, they could be considered as an autumn or overwinter treatment, and particularly you'd have to consider them if you believed you had or proved that you had triclabendazole resistance in liver fluke on your farm. The others available, oxyclosanide and albendazole, different drugs. Albendazole is oxalowormer as well, but they basically just treat adults. So they would be considered for this late spring treatment to try and get ahead of the infection and stop the infection getting into mud snails. So you would want an adult treatment that treats adult fluke at that time.
So we're deciding, or with veterinary advice, deciding on what product to use, based really thinking back to that mud snail life cycle, when the mud snails become more predominant on farm, and then obviously then how the liver fluke, their life cycle as well. So it's combining the two bits of information.
It is.
And obviously then with any diagnostic testing as well. When you're going to get the product, you, as a farmer, you tend to be, there's a row of different names out there. So obviously these are the chemical groups, so you need to be looking at reading the container really to see what's in it.
Yes, you do, because there are a number, not the vast range that there are with wormers, but there are a number of different names of products containing these. So as I say, it is basically, you've got the broad spectrum of triclabendazole, you've got the sort of intermediate spectrum of closantel or nitroxanil, and then you've just got the ones that just kill adults, which is oxyclosanide or albendazole, usually at an increased dose rate for albendazole.
And obviously the main focus of this today is liver fluke, but some of the products that would have a liver fluke treatment in them might also treat worms or sheep scab. Is it important, if you are using, to make sure you need them? You know,
oh, certainly.
Is it worth focusing really on a liver fluke product and maybe having a second think about any other ingredients you might need in them?
Yes, certainly. You don't want to be adding unnecessary treatments to any of your sheep. There may be times in a bad fluke year, there may be times where you do need a combined fluke and wormer, perhaps for your lambs in the autumn time, but generally with your adults you're treating fluke primarily, so just treat fluke and don't consider adding an unnecessary wormer to it. Save those for when you really need them.
So with the products available, you mentioned about potential resistance in terms of whether the products work. Could you say a little bit more about that? And what should farmers be doing to either know if they've got resistance problems or maybe not avoiding different groups? So maybe you could talk a little bit about that.
Yes, yes. Unfortunately, the wider spectrum liver fluke treatment, triclabendazole, we know that we have farms and areas that liver fluke is resistant to that drug. But it is important to try and find out whether you have got resistance or not, because otherwise it's a very useful drug, and if you can use it, that's very good. It's not as easy as looking for resistance in wormers, but you can do it by either using a fluke egg count reduction test, or you can use the copra antigen pre and post treatment to see if your fluticide has been effective. So yes, triclabendazole resistance definitely in the country. As regards the others, so closantel, which probably is used the most commonly after triclabendazole, and nitroxanil, we're not aware of any proven resistance in this country, but you always want to use it carefully. You want to use these drugs when they are necessary, but you want to optimize their use. So you want to use them properly, you want to use them at the correct dose rate and at the correct time as well, and not to misuse them.
If farmers are concerned, so they maybe use a product and they feel the sheep haven't quite responded, or they still might be concerned about liver fluke, are there other reasons why they might be having issues? So you talked before about the importance of timing, and none of these products have any long-acting effect.
No, none of these products are long-acting, unlike the wormers. So you're right. Certainly, you need to speak to your vet as to why you think these animals aren't performing despite a fluticide treatment. And it may be simply that you've killed what was there then, but they've continued to be infected, and you've got the effects of that. And don't forget that it is only triclobendazole that will kill them down to 1 week of age. So all the other products, the Llyngyr fluke will still be there growing up, and it may be that you're seeing the effects of that, or they've been reinfected. So you need to discuss with your vet, ideally, what you've treated, when you've treated, and add that together with the risk of fluke on your farm.
And I suppose if there's been a loss of condition, maybe due to liver fluke infection, it's going to take a while for those sheep to recover anyway.
Oh, certainly.
So,
yes.
And they're going to be more prone to other problems. So,
yes.
Obviously, easier said than done. Avoiding those problems to begin with, if you can get there before you see that conditional score loss, and it would be, I guess, one of the things you can do to help that problem.
And look at forecasts on the website, about the possibility of fluke in your area. Look at the diagnoses that we've made in your area through your vet. Ask your vet about that, to try and help you time these treatments to the optimum for your farm in your area. And as I say, as we discussed before, use of liver condemnation rates and fluke ELISAs in your lambs can be a big help as well to estimate what's going on your farm.
So in terms of liver fluke, obviously my understanding can be brought onto a farm through the purchase of stock, and also you can bring on resistant liver fluke onto the farm as well. So hear a lot about quarantine and biosecurity, but how important is that if you are bringing stock, either new stock onto the farm or returning stock from, say, winter tack? How important is quarantine as part of that in terms of liver fluke control?
Yes, well, you need to consider the risk of where these animals have come from primarily, and also what you're bringing them to. If you're an area if you're a farm that's never had liver fluke, and there are some about, then you really don't want to bring them onto your farm, because you may well have the mud snail, but it's not infected with liver fluke. So in that case, you want to ideally see if these animals are infected. First of all, if they are, you treat them with the most effective product. You check that product has been effective before you let them loose on your farm generally. As regards resistant fluke, a lot of farms know that they've got liver fluke, but they may not have triclobendazole resistance. So in that case, you don't want to buy it on. So in that case, you want to, similar steps, I suppose, you want to assess these animals that they're coming in, diagnose whether they're infected or not, treat them with something that isn't triclobendazole, because we know that's the most common product they're resistant to, but try to check efficacy. That's not so easy with some of the other ones, but it can be possible before you then let them on to your holding. Because once triclobendazole is there, triclobendazole resistance is there, the likelihood is you're never going to be able to use that drug again, a bit like the wormer story.
Yeah, so when you're thinking about quarantine, you can also be thinking about, for liver fluke, I suppose some of the products will also could potentially be tackling any issues in worms, so it's worth having a chat to the vet about what are the appropriate options in terms of combining different treatments. And
certainly, and also, the animals that you're buying on. So, a large group of store lambs from an area that's known to be infected with liver fluke, that's a risk, isn't it, as regards liver fluke, but also as regards the worms they may be bringing in. Individual ram, there'll be different risks associated with that one.
And once going back to the discussion we had about where the mud snails live on the farm, I suppose if you've got some high risk areas on the farm with that muddy environment, avoiding those with any new stock as well is that something that can be done to help reduce the risk to some extent?
You should certainly consider it to reduce down the risk. Yes, yes.
So it's just picking the bits you can do and really trying to reduce that risk of bringing problems in to begin with. And also then stock returning from winter tack to grazing. Is that something people should be thinking about in terms of treatments? And obviously in the dairy sector, there are limited options for treating for liver fluke. So is it worth having a discussion with the person you're sending sheep or lambs to, and
Certainly.
vice versa?
Yes.
To kind of make sure that people are aware of what's going on the different bits of land.
That's right, certainly, yeah, because it's the same liver fluke that infects sheep as infects cattle. So yes, your tack grazing with the dairy herd may well have infective stages there that your sheep will have picked up to bring back home to you. They may be triclobenzazole resistant, or you may be bringing back liver fluke that you've not had on your farm. So yes, just buying in sheep, that's only one part of the quarantine. It's bringing them back from those sort of areas as well.
And I suppose especially relevant if you've got new ground you're going to where there's been sheep on there previously from other farms where you don't know the history. So,
and don't forget, sheep put out far more fluke eggs per infection, if you like, than cattle do. So your sheep are the main implicators in spreading disease around, spreading liver fluke around, because they put out so many more eggs in the feces. In cattle, the liver tends to react in cattle, and it walls off the fluke a bit more and stifles the egg production a bit more. But sheep, can certainly spread liver fluke eggs.
So we've talked quite a bit about various options, and obviously you've got the mud snail life cycle, the liver fluke cycle, liver fluke's life cycle within the mud snail, different treatment options, ewes and lambs, all different testing options. Is there a value? So again, we're talking a lot about health planning. I suppose having that sit down with a vet or advisor to go through these things sounds like it's going to be worthwhile, given the range of options and information there is to take on board with liver fluke.
Certainly. We've shown really that control can be difficult in very warm, wet summers. So what you're trying to do with flock health planning, you're trying to minimise the effects, aren't you? Minimise your losses due to liver fluke. You want to make sure that if you are having production losses, that diagnosis is due to liver fluke for a start. If you don't do the diagnosis, it's really a best guess scenario. And put in measures to try and treat before your production losses are greater, have got to a level where it's unsustainable, or you're losing sheep. So yes, it is important to speak with people, because this disease also is so affected by the weather. It isn't a disease that you can say every October I treat, every December I treat, and then I treat February or something, because the weather affects it so much. So it's a disease that you want to ideally monitor on your farm. You want to go in at strategic times that's appropriate for your farm and the weather that's gone on, to minimise your losses. So that needs a bit of planning, and also it needs a bit of consideration through the year. You can't all plan it in advance, if you see what I mean. So sit down at the start of the year to think what you're going to do to prevent the infection getting bad in the autumn time, and then maybe consider later on in the year how things have gone. Do you need to repeat your treatments? Do you need diagnosis to see that the animal's still infected? Do you need to repeat it? What about later on in the winter time? Would they even need another treatment then? So yes, it is a complicated subject, so you need all the help you can get.
I suppose there's an element of cost towards health planning, but you must see from the samples and the cases that come into you in the labs here the significant cost of failing to deal with liver fluke. In terms of the cost comparison must be fairly small for actually the cost of health planning versus the cost when things go wrong, and they can go badly wrong quite easily, I suppose, liver fluke.
They can. I mean, you can have quite high numbers of losses very quickly in bad fluke years. I think the difficulty is Most people don't really understand the more insidious losses that you get with production losses. So yes, speaking, getting some key moments where you perhaps go in to diagnose what's going on and treat appropriately for the appropriate time of year can be very useful in sort of minimising the productivity losses that you will get with liver fluke.
And I suppose you work quite closely with local vets through the investigation centre here. So you're giving feedback to local vets about cases coming in. So by doing the health planning and maybe speaking as a farmer to your own vet more, you're going to be getting access to more than their information. They're part of a bigger network.
Yes, that's right. So all that we do, we often get vets phoning us saying, are you seeing much of this at the moment or whatever? So we get that sort of local interaction. Even if they haven't sent something in, they're asking what have others seen in the area. But also don't forget that we also feed into a network that is England and Wales based. So all our diagnoses go onto a much sort of bigger database that can show you what's going on in different areas around the country. And you can actually visualise that. There's an APHA vet gateway where you can go and look at the diagnoses made in certain areas. You don't need a vet to be a vet to look on, that's open access. And you can see the diagnoses for things like liver fluke over a very short period or going back over a number of years. But your vet will be informed by things that he sends in from his clients, but also the wider information. We send out monthly reports to vets. Some of that may get repeated in newsletters as well. So yes, keep in touch with your vet as to what's going on in your area to help you keep informed.
And is it also correct that if you do suspect resistance and either suspected, it's worth talking to your vet because there is a procedure in place for dealing with suspected failure of any products?
Yes.
And also then, as the wider industry, the more we know about what's going on in terms of products working or maybe not, that then is a good thing for the industry in terms of government support or new product development. So it's always worth, if you're not sure if your product's working, yes, always worth reporting that to your vet. And
it certainly is. And the Veterinary Medicines Directorate have a scheme whereby lack of efficacy should be reported. You can do it, or through your vet you can do it, and that is very important so that these reports are collated. That helps generally the drug companies to see what's going on, as well as government. So yes, it is very important that you talk to your vet about that and maybe report any lack of efficacy. We would also be very interested if you were concerned about any of the other flukicides not working, because our concern is with just a small number of drugs that some of the others will start not to be as effective. So we would help your vet investigate, and we would do our best to investigate very fully if you were suspicious of lack of efficacy in some of the other flukicides. Because what we do is, if that was detected, we would generally publicise it without identifying the farms involved, obviously, but generally publicise it, and that can help to get government's priorities altered. It may help to put a bit more pressure on drug companies to consider either resurrecting some of the older drugs, or even if research is well along, considering newer drugs into the market. So yes, that's the advantage of getting a diagnosis, and with us, with surveillance, then information can be spread more widely.
And having spoken to farmers who've had specific problems, liver fluke, and they can be quite devastating when you are coming across losses or by poor production and poor condition score. Tends to be, you see those things in the middle of winter when it's raining and everything's feeling quite miserable. But it sounds like, although there's no quick immediate answer, there are lots of things that can be done over the period of a season to help stop that problem occurring the following year.
Yes. Yes,
just through this planning process, which is important, so as not to forget when the sun comes out then and it's been dry, so it's easy to forget then, isn't it? So it's
yes, it is important to investigate your losses, to investigate poor production, so that you can then Well, if you don't get a diagnosis, then it's a sort, you could throw an awful lot of money thinking, oh, it must be this or it must be that. If you can get a diagnosis, then you're right, you've got the options of doing what you can to mitigate your losses at that point, but then it can help you to plan ahead. I had this problem this time last year, or I know I had a bad problem with liver fluke. I'll go in earlier, I'll try and prevent my losses earlier, or I'll be aware, or I'll go in with treatment at this sort of time. So diagnosis is very important in controlling disease going forward.
And as was this year in particular, there's been a lot of talk about the cost of forage and potential lack of forage availability this winter. And to some extent, if a farm has got a very high liver fluke burden that hasn't been dealt with in sufficient time, you're using expensive feed. You're feeding parasites before the sheep. So
yes,
it's that feed efficiency element to it as well. I suppose the fact they've got liver fluke must have a massive impact on their ability to consume feed and convert it. And there's no point feeding liver fluke, is there?
Occasionally, and it is only occasionally, we come across animals in quite reasonable condition, but with livers that are totally devastated by liver fluke. And yes, you think that farmer has spent a lot of money feeding that sheep and feeding those liver fluke rather than getting the benefit all from the sheep. Yes, it is occasional, but yes, we can see animals like that.
Yeah. So I think we've covered quite a bit today in terms of the disease, its life cycle, treatment options, trying to stop things going wrong, and obviously things like diagnosis and health planning. In terms of the next steps, if a farmer's concerned about liver fluke, or really majority of probably sheep and beef farms in Wales, especially West Wales, should be thinking about liver fluke as something to bring into their health planning. So to my mind, really the next step will be for them to speak to their vet in terms of this season in particular, treatment options for this autumn, the right product, the kind of timings they might want to look at, and also then the value of any specific testing to know when they need to be doing it. So that could be serology of lambs, it could be the core antigen test or the adult liver fluke test. And then maybe looking at a follow-up to see if it's working, and putting in some place some performance indicators. So obviously, if users are in good condition, that doesn't stop them being at risk of acute fluke, but it does help sort of get a handle on what the flock is doing. Looking then maybe at last year's losses, last year's barren ewe rate, scanning results. So just having a think at this time of year, moving forward for the next 12 months. So veterinary advice really will be the key element, and obviously as a vet then they can also have a chat things like the other parasites, so the roundworms, and I know we've had some dry weather, but now the rains come sort of middle of August, those other parasites are going to be having a bigger impact probably on lamb performance.
Yes, and don't forget that this time of year, particularly with a dry summer, those lambs probably haven't been exposed to the same extent. So they would not have had much of a chance to build up much in the way of immunity. Yeah. So now that the weather has changed, then you need to think about that.
So the next 4 to 6 weeks are a great time to speak to your own vet about sort of parasites, and also I suppose people buying in rams or buying in breeding females. That's again that quarantine element to consider. Obviously, in terms of Farming Connect have various support mechanisms for farmers, and I suppose there are quite a lot of options out there. So I suppose the message really is to have a chat to your local development officer, to have a look at the Farming Connect website. If you're not registered with Farming Connect, there's a number there you can phone, and also there's a list on the website of who your local development officer is, and they'll be up to date with various events that are going on, various access to technical support, and also things like any courses or training that might be out there. So I think we've had a good chat about liver fluke. I think it's a fascinating parasite, and it just always amazes me then how robust maybe livestock are sometimes when you must see all sorts of things coming through in the labs, and the fact that animals have survived that long. So I think trying to get in earlier with disease in terms of the impact it's going to have on production and profitability going forward is a strong message, regardless of whether it's liver fluke or any other disease in sheep or cattle really. But I'd just like to thank you, Sian, for your time today and for chatting to me about liver fluke. And hopefully you won't see too many liver fluke cases coming through this year.
I hope not.
But yeah, so I think, but just to say how useful I think that ability to have animals going off to be tested as well. Again, there is a post-mortem collection service, so it's worth having a chat to your own vet about the options for getting samples coming in. And I think sort of testing and diagnosis is going to become more important moving forward. So I think having that dialogue, going with your vet is always going to be worth it, really. So
certainly.
On that note, thank you for today, and just to encourage anybody to say, go on the Farm Connect website, have a chat to your local drum officer, and definitely speak to your own vet about how you can help get to grips with liver fluke in sheep. Thank you for listening.